Have you ever loved someone who made you feel invisible? What if the person you love the most is also the one who causes you the deepest pain? Imagine being in a relationship where your feelings are constantly dismissed, your achievement belittled, and your world revolves entirely around someone else's needs. Is not just a toxic relationship, it could be a sign of something more profound: narcissistic personality disorder. I'm Dr. Katia Batista, psychiatrist, and today let's talk about it. Narcissistic personality disorder is classified in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition DSM-5, under Cluster B personality disorders. These disorders are characterized by dramatic, emotional, or erratic behaviors. Individuals with cluster B disorders often struggle with emotional regulation and interpersonal relationships. Narcissistic personality disorder is defined by a pervasive pattern of grandiosity, a constant need of admiration, and a lack of empathy, beginning by early adulthood and present in many contexts. This pattern leads to significant impairment in personal, social, and occupational functioning. Key features of narcissistic personality disorder include grandiosity, an exaggerated sense of self-importance and superiority, need for admiration, a constant craving for attention and validation, lack of empathy, inability to recognize or identify with the feelings and needs of others, exploitativeness, taking advantage of others to achieve personal goals, envy, belief that others are envious of them or feeling envious of others, arrogance, displaying haughty behaviors or attitudes. These traits are not occasional but are persistent and inflexible, affecting many aspects of the individual's life. Let's go a bit deep about how a person who is suffering from narcissistic personality disorder is in a romantic relationship. Being in a relationship with someone who has this kind of condition can be emotionally draining and damaging. Common patterns include idealization and devaluation. Initially, the partner may be idealized, but over time they are devalued and criticized. Manipulation, using tactics like gaslighting to control and undermine the partner's reality. Lack of emotional support. The partner's needs and feelings are often ignored or dismissed. Boundary violations. Disrespecting personal boundaries and autonomy is something that frequently happens. This dynamic can lead to significant emotional distress, confusion, and a diminished sense of self-worth for the partner. Let's differentiate a narcissistic personality disorder from narcissistic traits. It's essential to differentiate between these two, just to understand a being. So narcissistic traits, they are occasional behaviors like seeking admiration or feeling special, which can be present in many individuals without constituting a disorder. In the other side, narcissistic personality disorder is a pervasive and inflexible pattern of narcissistic behaviors that lead to significant impairments in functioning in relationships. The key difference lies in the severity, consistency, and the impact of the behavior on the individual's life and those around them. For those in relationship with individuals exhibiting narcissistic behavior, set boundaries. Clearly define and maintain personal boundaries. Seek support. Engage with therapists, support groups, or trusted individuals to navigate the relationship dynamics is essential. Educate yourself. Understanding narcissistic personality disorder can empower you to make informed decisions. For individuals recognizing these traits in themselves, let me give you the treatment approaches for it. Treating narcissistic personality disorder is challenging, but not impossible. Therapy can help individuals develop self-awareness, manage emotions, and improve relationships. Two effective therapy approaches are cognitive behavioral therapy and schema therapy. Cognitive behavioral therapy focuses on identifying and modifying negative thoughts patterns and behaviors. For narcissistic personality disorder, cognitive behavioral therapy techniques may include cognitive restructuring, identifying distorted beliefs about oneself and others, and reframing them to be more realistic and balanced. Behavioral experiments, testing new behaviors in real-life situations to challenge narcissistic assumptions, developing empathy, practicing perspective, taking exercises to understand others' feelings and needs. These techniques aim to reduce grandiosity, enhance empathy, and improve interpersonal functioning. And the other side, schema therapy combines elements of cognitive behavioral therapy, psychodynamic, and attachment theories to address deep-seated patterns. It targets maladaptive schemas such as entitlement, belief that one deserves special treatment, defectiveness, shame, feelings of being unloved, emotional deprivation, expectation that one's emotional needs won't be met. Therapists were to identify these schemas and help clients develop healthier coping strategies. But there's still, like I say, they are challenging the treatments. Individuals with this kind of condition may receive therapy due to the lack of insight or fear of vulnerability. Building a strong therapeutic alliance is crucial. Therapists must balance validating the client's experiences while gently challenging maladaptive patterns. Of course, there are pharmacological treatment, but the most important approach is the therapist. The outcomes are really better compared with the pharmacological approach because there is no specific medication designed to treat narcissistic personality disorder itself. However, can be helpful in managing symptoms that often co-occur with it, such as depression, anxiety, or mood instability. Commonly used medications are antidepressants, selective serotonin reuptake inhibitors like fluoxetine or sertraline. This can help reduce symptoms of depression, like I said, or irritability that may come with narcissistic traits or disorder. mood stabilizers, such as lithium, lamotrigine, used in cases where mood swings or impulsivity are present. Anxiolytics, some benzodiazepine can be prescribed, but it's just for short term to severe anxiety because we know they cause dependence. Medication alone, let me highlight this, is not considered effective for treating the core traits of narcissistic personality disorder. It works best when combined with psychotherapy, especially when the individual is motivated and engaged with treatment. Understanding narcissistic personality disorder is the first step towards healing and building healthier relationships. Whether you are experiencing these challenges personally or supporting someone who is, remember that help is available and change is possible. If you have ever had an experience with someone who shows traits of narcissistic personality disorder, or if you have ever wondered about your own behavior, please feel free to share your thoughts in the comments. Your story might help someone else feel seen or understood. Don't forget, please, to like, share, and subscribe to help raise awareness about mental health. Let's keep the conversation going. Thank you.